welcome to Oral and Facial Surgery of the Carolinas. Today we're going to be talking to you about wisdom teeth removal. Here are 3 things that you need to know before your procedure. Number 1, we ask that you arrive 15 minutes early. There's a lot to get done, so if you could be on time, that would be awesome. Number 2, we ask that you do not eat or drink anything at least 6 hours before your procedure time. This means no food, no drink, no milk, no juice, no nothing. Unless you're taking pre-medications, you can have just a little bit of water to help get those down. Number 3, we ask that you have a reliable source of transportation. You're not going to be able to drive yourself home, so we need a family member or a friend who's at least 18 years or older. We will bring you back to the room, sit you down, and begin setting you up by putting stickers on your chest to monitor your heart rate, a blood pressure cuff on your arm, oxygen cannula in your nose, and a pulse oximeter on your finger. Since this needs to go on your finger, we ask that you do not have any artificial nails on and that your nails are well trimmed. We will then lay you back and search for a place for the IV. You will then be given some medication to help you relax. This medication will make you sleepy and take away the pain and memory of the procedure. Once you are nice and sleepy, we will then send your parent or guardian out to the waiting room. The surgeon will come in and he will take out your wisdom teeth. Once you are done, we will sit you up, place gauze in your mouth, remove your IV, and remove all of the stickers. We will then bring your parents back in and go over some discharge and post-op instructions. We will send your parents to the car and bring you out to meet them.
Congratulations, you did it, you're done. Your next stop will be to go pick up your prescription and then go home. When you get home, take the gauze out that we put in for you and replace it with the clean gauze in your post-op bag.
Okay.
If after an hour you are still bleeding, take a damp tea bag and place it where your gauze was. The tannic acid in the tea is going to help stop the bleeding. You're going to have pain and swelling for about 2 to 3 days. To help with that, ice your face in 20-minute intervals and keep your head above your heart. So what can you eat? Nothing chewy, sticky, crunchy, or spicy. And no straws either. Straws change the pressure in your mouth and can cause that little clot to come out prematurely and cause dry socket, which we really want to avoid. And no heavy lifting or lifting over your head. So what do you do now? You have little holes where your teeth used to be, and it's going to close up smaller and smaller throughout the week. So it's very important you rinse out with warm salt water with that syringe we put in your post-op bag. If you skip this step, it can lead to infection, so it's very important that you do. When you brush your teeth, use a soft bristled toothbrush that we put in your post-op bag, and try to avoid your stitches. And yes, you may have stitches where we extracted your tooth, but don't worry, they're dissolvable and will dissolve all on their own in about a week. When you brush and rinse, do not spit. Spitting also causes dry socket. Just let the water fall out of your mouth over the sink. That's about it. If you have any questions, don't hesitate to call. See you on surgery day.